Welcome back to the channel. Thank you for tuning in. This video is something that I decided to do impromptu. I hadn't planned for it. But I'd like to address a topical subject which is making the news at the moment. So yesterday there was a BBC news item which also talked about this topic. And it's all about nurses in Ghana, registered nurses, midwives, leaving the healthcare system and, the hospitals suffering as a result of that, patients suffering because there are not enough nurses. And we all know that this issue of brain drain is not a new thing. It's probably getting worse at the moment, getting worse at present, but it's not a new thing. Nurses have been migrating from Africa, from Ghana to Western countries for many, many years. My first experience of coming into contact with projects that were aimed at mitigating the brain drain or bringing some solutions to the brain drain was the Ghana Mental Health Project. And this was a project which was initiated by the International Organization for Migration. So they've got this migration and development section who came up with this idea of the Ghana Mental Health Project. And what they did was they targeted Ghanaian healthcare professionals who are living in the UK and in the EU at the time. So they created a database, and it was for all specialties of healthcare professionals. You had nurses, midwives, doctors, etc. And after coming up with this database, they also liaised with the healthcare facilities in Ghana, hospitals in Ghana, and the health institutions, nursing training colleges, medical schools. So a needs assessment report was also compiled from Ghana. So what they did was they matched this database of human resource Ghanaian healthcare professionals abroad and matched it to the needs. So what we would do is you would identify with a hospital or training college and you develop your action plan, whether it's a training or skills share, and you would go. The first phase of the project started in 2006. So my first experience was in June 2006, where I went to the Kintampo Rural Training School. That was the name then. I think the name has changed now. For 2-week training, I went to a group of Ghanaian doctors and nurses. And following on that, I was also involved in subsequent assignments to other nursing training schools and also hospitals to implement training and also skills sharing, capacity building. And out of that project, I would say that the relationships formed with some of the health institutions, with the colleagues back in Ghana, some of the connections still, it still holds up until today, and other things have arisen out of these connections created. So, what am I saying to all these nurses moving the brain drain? I believe that there is a great resource that is not being tapped, and this is those of us or healthcare professionals who've come here who have gained a lot of experience, skills, and they want to give back. But sometimes the frustration of the processes that needs to happen before people can even go and give back or go and work for a short period in a hospital or a training school. And one of the things that maybe somebody can, give me an answer to this. But when you look at some of the teams that come from abroad, and they may not be Ghanaians, they may be, American, British, or other professionals. They can come in a team and come and implement whether it's surgeries or um, clinical work for a short period. And I wonder, are they required to go through the stringent, measures? Do they have to write exams? Do they have to register with anybody? Do they have to do all that before they come? Because I don't have any evidence. Correct me if I'm wrong. But then sometimes when people like the Ghanaian who knows the terrain, who knows the language, who knows, the system, wants to come back and probably help, then you are faced with all these bureaucratic, processes, and people get frustrated and people abandon that. And some people wouldn't even try just for the sake of not, going through all that hassle. They wouldn't even dare. And for somebody to come to the UK or US or wherever to work for so many years, and for them to have the heart that, I want to go back to my country. I want to offer my services. Maybe I'm there for a month, I'm there for 2 weeks. I want to just go to this clinic and maybe share my experience with them, or maybe offer, just take care of the patients. For somebody to do that, it means that they are doing it out of love, out of compassion, out of duty, because the truth is, whatever pay or whatever wages that they would have, it's nothing compared to what they receive in their host countries where they live. So they are not doing it for the money. They are doing it because they want to serve their country. So I believe that this great resource, we really need to think about, what ways can we make it easier for people, healthcare professionals, nurses, doctors, midwives, pharmacists. How can we make it easy for them to give back, even if it's for a short term? How can we make it easier? I mean, I'll talk about nurses, for example, in the UK, because I live in the UK, and we have a robust revalidation process. Every 3 years, you have to revalidate. And before your revalidation form is signed, you would have gone through vigorous forms completion for somebody to check the number of hours you've worked, the CPD training you've done. You write your reflections on experiences that you've had, and you would have somebody that you will discuss, these reflections that you've written with them. And then you have another person who will look at all these documentation and actually sign you off. So we have the revalidation process, the revalidation evidence is there. And anybody who works with an organization, they have supervisors, they have managers, the hospitals that they work with can provide evidence. So, how can we make it easy and less cumbersome for people who have lived here, gained experiences, gained the skills, who want to give back? Because I tell you, there's a lot of skills going to waste. There's a lot of skill and knowledge going to waste that we are not tapping at all. At the moment, we are all focusing on the brain drain, on the people leaving. What can we do? What can we? And truth is, all these push factors, the poor working conditions, the salary that is not enough, the equipment that they don't have. I don't know how fast this can be fixed for people to stay, because it's going to go on and on. People are going to leave. But what about this resource? Okay, people have come, they've gained. How can we make this brain drain a brain circulation to get it back into the system? That is my question. How can we make it more feasible for people to come and give back? I don't know whoever is listening, the authorities, the NMC, Ghana Health Service. I believe that the African Diaspora Human Capital is not tapped, fully tapped. And this is a resource that we can't afford to let it go to waste. Let us find solutions. Let's find strategies that will enable people to come back and give back and make a contribution to our nation. Thank you for watching, and I'll be reading your comments. So I see you in the next one. Take care and bye.